The spleen. The stomach receives foods and digests them, and then the spleen digests them for a second time before sending them to the lungs to be transmitted to all parts of the body. The most important energy of the human body is what is called true energy, which is in close relationship with the spleen and the lungs. The spleen sends digestive foods to the lungs to be mixed with the energy of the air inhaled by the lungs, and the two energies from the important ingredients of true energy. This is why the spleen is capable of producing energy. Therefore, when a person is suffering from energy deficiency accompanied by spleen deficiency, the function of the spleen in producing energy may have already been impaired and should be treated first. The spleen governs the blood circulating throughout the entire body to prevent the blood from overflowing outside the blood vessels. Energy deficiency of the spleen may impair its function of governing the blood, resulting in various types of bleeding. As spleen energy is capable of elevating, it can transport pure energy and pure substances of water and grains upward to the lungs and then to other internal organs to be transformed into energy and blood. If spleen energy fails to elevate and caves in instead, then symptoms such as shortness of breath, too tired to talk, chronic diarrhea, prolapse of the anus, prolapse of the uterus, and falling of other organs will occur, which are due to middle energy falling. The spleen likes dryness and dislikes dampness. When the spleen fails to perform its functions of transformation and digestion due to its deficiency, it will generate dampness. Conversely, excessive dampness will contribute to the difficulty of the spleen in performing its functions. When the spleen is being troubled by dampness, such symptoms as these will occur: heavy sensations of the head, feeling as if the whole body is sinking down, discharge of watery stools, and white and greasy coating of the tongue. For this condition, it is necessary to dry up the dampness and strengthen the spleen, and the herbs used should be relatively warm and dry. The stomach. The stomach performs the functions of receiving and digesting foods. It is also in charge of pushing down turbid substances. When stomach energy moves downward, water and grains will also move downward, which contributes to digestion, absorption, and excretion. If instead of moving downward, stomach energy moves upward, then it will cause symptoms such as belching, hiccups, nausea, and vomiting. The stomach likes dampness and dislikes dryness. It is very susceptible to the attack of heat, which is called the hot stomach syndrome. When heat attacks the stomach, it will cause harm to stomach fluids and cause such symptoms as dry tongue and mouth and thirst with craving for drink. To treat the hot stomach syndrome, it is necessary to nourish the yin of the stomach and produce fluids. The spleen and the stomach form a yin-yang relationship in that the spleen is a yin viscous while the stomach is a yang bowel. The spleen is in charge of elevation, whereas the stomach is in charge of downward movements. The spleen likes dryness while the stomach likes dampness. They rely on each other in order to exercise control over each other in performing their respective functions of digestion and absorption. Energy deficiency of both the spleen and the stomach is a distinct syndrome in Chinese medicine. This syndrome may be seen in ulcers, chronic gastritis, chronic enteritis, chronic dysentery, functional disorders of the stomach and intestine, tuberculosis of the intestine, chronic hepatitis, and cirrhosis of the liver, with such symptoms as poor appetite, belching, swallowing of acid, nausea, vomiting, stomachache with desire for massage, pain getting better after a meal, fullness of stomach, abdominal swelling with discharge of watery stools, and edema. Should the disease become chronic, these symptoms will occur: withered and yellowish complexion, fatigue, weakness, loss of weight, light color of the tongue with white coating, fat and tender tongue with tooth marks appearing, and soft and weak pulse. To treat this syndrome, it is necessary to strengthen the spleen and harmonize the stomach. Deficiency, coldness of the spleen and the stomach is in another common syndrome called yang deficiency of both the spleen and stomach. It may be seen in ulcers, chronic gastritis, chronic enteritis, chronic dysentery, functional disorder of the stomach and intestine, edema, chronic hepatitis, and cirrhosis of the liver, with the following symptoms: abdominal pain, love of heat and warmth, full of clear saliva, hiccups, vomiting, poor appetite, abdominal swelling after meals, fatigue, weakness, cold limbs or scant urine, puffiness, whitish vaginal discharge, light color of the tongue with white sliding or white greasy coating, and a deep, fine, weak pulse. In treating this syndrome, it is necessary to warm and tone up both the spleen and the stomach. Another common syndrome called stomach fire may be seen in high fever stages of various contagious diseases, diabetes, periodontitis, and mouth ulcers, with the following symptoms: thirst with craving for cold drink, periodic stomachache with burning sensations, red tongue, yellowish and thick coating of the tongue, dry tongue, and big and forceful pulse or sliding and rapid pulse. In order to treat this syndrome, it is necessary to clear and sedate stomach fire. Stomach urine deficiency also occurs and may be seen in chronic gastritis, gastric neurosis, indigestion, and diabetes, with the following symptoms: dry lips and mouth, lack of appetite, abdominal swelling after meals, discharge of dry stools, dry vomiting, hiccups and dry tongue or burning pain in the stomach, red tongue with scant coating, and fine and rapid pulse. To treat this syndrome, it is necessary to nourish the urine in the stomach and clear the heat in the stomach. The lungs. The lungs are situated in the thoracic cavity and have the throat as their door and the nose as their outlet. They are a yin viscous, forming a yin-yang relationship with the large intestine, which is a yang bowel. The lungs are in charge of the respiratory energy or the energy of air. When the lungs fail to control respiratory energy properly, they will give rise to cough, asthma, or difficult breathing. After foods have passed through the stomach and spleen have been digested properly, they are mixed up with clear energy of the lungs to become important ingredients of true energy for distribution throughout the entire body. When the lungs fail to distribute true energy properly, such symptoms as fatigue, weakness, shortness of breath, too tired to talk, and excessive perspiration will occur. These are all symptoms of the syndrome called energy deficiency of the lungs. The lungs should be able to expand so that air can go through the nose and the mouth easily. When the lungs fail to expand, congested chest, cough, or asthma may occur. The lungs should be able to push energy downward, and when they fail to do so, cough, asthma, scant urine, or edema may occur. The lungs are in charge of opening and regulating waterways. Circulation of blood. Circulation of body fluids is a function of many organs working together as a team, including the lungs. Under normal circumstances, the lungs are capable of sending fluids downward to the kidneys, which pass the fluids to the bladder for excretion. When a pathogenic energy attacks the lungs to impair their normal functions, it will give rise to such symptoms as diminished urination and edema, which is why it is often said that the lungs are the upper source of water. The lungs are in charge of the voice, because the production of the voice and the functions of the lungs are closely related to each other. When the lungs are full of energy, the voice will be loud. When the lungs are suffering from energy deficiency, the voice will be feeble. Cold and wind may attack the lungs to cause energy congestion of the lungs, which will give rise to hoarseness or loss of voice. The lungs use the nose as an outlet. The nose is a passage through which air comes and goes, so it is directly related to the lungs. When the lungs are functioning normally, air will go through the nose very smoothly and there will be a normal sense of smell. When the lungs are diseased, it will give rise to nasal congestion, nasal discharge, and an impaired sense of smell, and in severe cases, there may be a flickering of the nostrils and difficult breathing. The lungs are in charge of the skin and the hair. The skin and hair are the outermost regions of the human body, and the lungs can send defense energy and body fluids to them for nourishment. When the energy of the lungs is normal, the skin and hair will be moist and smooth, and the pores will be well guarded. But as soon as the energy of the lungs becomes deficient, there will be a shortage of defense energy, and the outermost regions will not be guarded properly. which will give rise to excessive perspiration and the common cold. Both the lungs and the heart are situated above the diaphragm, with the lungs in charge of energy and the heart in charge of blood. When energy flows, the blood will circulate, and when energy congestion occurs, blood circulation will be impaired. Thus, the lungs and the heart can be seen to work together in control of energy flow and blood circulation. The lungs are in charge of energy, and the spleen can produce energy. Thus, lung diseases can, in many cases, be treated by toning up spleen energy. For example, a chronic cough with a great deal of white sputum can be treated this way. The lungs and the large intestine form a yin-yang relationship with each other. Therefore, a cough and asthma due to excessive heat in the lungs can be treated by sedating the large intestine to clear up sputum heat, so the energy of the lungs will move downward, producing relief of the cough and asthma. And constipation, which is a symptom of the large intestine, may be due to energy deficiency of the lungs, in which case the energy of the lungs should be strengthened to relieve the constipation. The large intestine, the function of the large intestine is to excrete waste matter. When the large intestine is suffering from deficiency, it will cause constipation. When it is suffering from excess, it will cause diarrhea. Dampness, heat of the large intestine is a common syndrome often observed in acute bacillary dysentery, acute onset of chronic dysentery, and amoebic dysentery, with the following symptoms: abdominal pain, tenesmus, diarrhea with discharge of pus and blood, burning sensations in the anus, short streams of reddish urine, fever, yellowish and greasy coating of the tongue, and sliding and rapid pulse. In severe cases, there may be fainting and coma. In order to treat this syndrome, it is necessary to clear up heat and transform dampness in the large intestine. The kidneys. The kidneys are important organs in charge of growth, reproduction, and maintenance of the metabolic balance of water. Also, the kidneys are in charge of storing pure substances inherited from one's parents. Thus, the kidneys are innate roots of life. It is also believed that the formation of the fetus begins in the kidneys, and that the two kidneys are formed prior to the body itself. So the kidneys can be seen as the roots of the viscera and the bowels, as well as the 12 meridians. In clinical practice, some cases of slow growth of an innate nature are dealt with by treating the kidneys. Moreover, the kidneys are situated in the lumbar region, and for this reason it is said that the loins are the residence of the kidneys. So when the kidneys are diseased, symptoms may occur across the loins. The kidneys include kidneys yin, true yin, or kidney water, and kidney yang, true yang, or life door fire. As already mentioned, the kidneys are in charge of storing pure substances, but pure substances refer to two different things. First of all, they refer to the pure substances of the 5 viscera and the 6 bowels derived from water and grains that have been digested and transformed by the spleen for distribution throughout the whole body, with extra pure substances stored in the kidneys for future consumption. The pure substances also refer to those of the kidneys themselves, derived from the innate sources and mixed with the acquired energy of water and grains, which are closely related to the reproduction, growth, and aging of the human body. For this reason, when the pure substances of the kidneys are in short supply, a man may suffer from shortage of semen and infertility, while a woman may suffer from suppression of menses and infertility, slow growth, and premature aging. All of these symptoms should be treated by toning up the kidneys. The kidneys take charge of water. The regulation of body fluids is closely related to the following 3 organs: the lungs, spleen, and kidneys. This is called energy transformation of the triple burning space and was originally initiated by kidneys yang. The kidneys are closely related to the growth and the softness or hardness of bones. For instance, in children, a fontanelle not closed after a long period of time can be dealt with by treating the kidneys. The same applies to soft bones in children and to the inability of an adult to stand up for very long due to weak legs. Teeth are extensions of bones, and loose teeth or teeth falling out are due to deficiency of kidney energy. The kidneys are in charge of storing pure substances which generate marrow. Marrow nourishes the bones and gathers in the brain. This is why it is said that the brain is the sea of marrow. Kidneys energy deficiency, which is a common syndrome, may give rise to low intelligence, slow movements, and soft bones. In recent years, Chinese acupuncturists have applied the kidney point in auricular acupuncture to treat incomplete growth of the cerebrum in children and after effects of brain concussion, and the Chinese herbs that tone up the kidneys have been applied to treat aplastic anemia. Under normal circumstances, the heart and the kidneys remain in balance, depending on each other as well as controlling each other, which is called mutual adjustment of yin and yang, or communication between the upper organ and the lower organ. The heart yang is in the upper region, whereas the kidneys yin is in the lower region. The heart yang must rely on the kidneys yin for its supply of yin energy, while the kidneys yin must rely on the heart yang for its supply of yang energy. The interdependence is necessary in order to maintain normal functions of the human body and is called communication between the heart and the kidneys in Chinese medicine. When the heart of the kidneys are disordered, which disrupts the normal relationship between the two organs, insomnia, palpitations, forgetfulness, lumbago, and seminal emission can occur, which are the symptoms of the heart and the kidneys being incapable of communicating with each other. The kidneys are also related to the liver. The liver is in charge of storing the blood, and the kidneys are in charge of storing pure substances. Pure substances and blood can generate and transform each other, which is why I said that the liver and the kidneys originate from the same source. Under normal circumstances, kidneys yin will nourish and water liver yin. But when the kidneys are suffering from yin deficiencies, the kidneys will be incapable of doing so, which will cause such syndromes as liver yin deficiency and liver yang upsurging. This is called water incapable of nourishing wood in the 5 elements theory. On the other hand, yin deficiency of the liver will also cause yin deficiency of the kidneys. When both the liver and the kidneys are suffering from yin deficiency simultaneously, it is called yin deficiency of both the liver and the kidneys, which will cause such symptoms as lumbago, dizziness, and being hasty and jumpy. The kidneys and the bladder are connected with each other through meridians. The condition of the energy of the kidneys has direct bearing on the capacity of the bladder in urination. This is why the kidneys and the bladder are said to form a yin-yang relationship with each other. The bladder. The bladder is in charge of storing urine and controlling urination. When the bladder is disordered, it will cause urination disorders and difficult urination. The reason that the bladder is capable of urinating is due to the energy transformation of the kidneys. When the energy transformation of the kidneys breaks down, difficult urination and retention of urine occur. And when the kidneys are suffering from deficiency, dribbling of urine and incontinence take place. Bladder dampness heat is a common syndrome observed in urinary infections, urinary calculus, and prostatitis with the following symptoms: frequent urination, pain on urination, or difficulty in urination, sudden interruption during urination, reddish, yellow, and greasy coating on the tongue, and sliding and rapid pulse. To treat this syndrome, it is necessary to clear pee and remove dampness. The pericardium. The pericardium is the protector of the heart. It is also its messenger. The pericardium is partially responsible for the symptoms of the heart, such as dizziness and delirium, which are normally considered symptoms of the pericardium as well. The heart is in control of the spirits, and it is the great master of the 5 viscera and the 6 bowels. When the heart is under attack, the patient will die due to its impact on the spirits. But according to Chinese medicine, this doesn't happen very often, simply because before the pathogenic energy gets a chance to attack the heart itself, it must attack the pericardium. The triple burning space. The triple burning space refers to the 3 cavities in the human body, namely the thoracic cavity, the upper burning space, the abdominal cavity, the middle burning space, and the pelvic cavity, the lower burning space. Why is it called the triple burning space? The reason is that this organ contains 3 parts, heats up the body, and is not really an organ but rather a cavity-like space. According to the Yellow Emperor's Classics of Internal Medicine, the triple burning space is the irrigation official who builds waterways. However, in performing this duty as an irrigation official, the triple burning space must cooperate with other internal organs, notably the kidneys, bladder, and lungs. The kidneys and the bladder form a yin-yang relationship with each other, and the kidneys are connected with the lungs and the upper region. Thus, the triple burning space performs the irrigation duty in cooperation with the kidneys, lungs, and bladder, and particularly the lower burning space that excretes water into the bladder. Disorders in the triple burning space may give rise to many urinary symptoms, including suppression of urination, dripping of urine, and edema. The Yellow Emperor's Classic states, when the triple burning space suffers from an excess disease, it will cause anuria. When it suffers from a deficiency disease, it will give rise to enuresis. The same classic says the symptoms of the disease of the triple burning space are as follows: congested abdomen, especially hardness in the lower abdomen, anuria that creates a desperate desire to discharge urine, and retention of urine that leads to an accumulation of water in the body and causes swelling. According to another Chinese medical classic, when heat is present in the upper burning space, it will give rise to cough and pulmonary tuberculosis. According to still another classic, excessive heat in the upper burning space will cause perspiration on the forehead, abdominal swelling, pain in the rib region, dry tongue, scorching mouth, and blocked throat. Coldness in the upper burning space will cause inability to eat, vomiting of acid, pain in the chest and back, affecting each other, and dry and sore throat. When the heat is present in the middle burning space, it will give rise to various types of dry and hard symptoms, such as constipation, abdominal swelling, and cough. When the middle burning space suffers from deficiency and cold, it will give rise to incessant diarrhea, indigestion, fullness in the middle, and intestinal swelling and rumbling. When the lower burning space is deficient and cold, it will give rise to enuresis, incontinence of urination, and diarrhea. When the lower burning space suffers from excessive heat, it will give rise to discharge of urine containing blood, urination difficulty, suppression of urination, and difficult bowel movements. The brain, marrow, and womb. In addition to the viscera and the bowels, there are other organs such as the brain, marrow, and womb, which are called the odd and constant organs. In distinction from the viscera and the bowels, each type of organ performs a different function and at the same time is connected with the others and influences the others. In addition to the brain, marrow, and womb, the odd and constant organs include bone, vessels, and the gallbladder. It seems that the gallbladder alone occupies a special status in the human body, as it is regarded both as a bowel, as mentioned earlier, and as an odd and constant organ. The brain is the uppermost organ among the 6 odd and constant organs, and it is the material base of all mental activities. Therefore, the brain is also called the organ of original spirit. The pathways in which the marrow travels upward and downward extend to the brain on the top and to the coccyx and sacrum at the bottom. This bears a resemblance to the conception of the central nervous system in modern Western medicine. The brain and marrow are closely connected to the kidneys. The kidneys are in control of bones. Bones generate marrow, and marrow travels through the brain, which is the sea of marrow. Hence, when the pure energy of the kidneys is in abundance, the marrow and the brain will be in full supply, and consequently one will be energetic and in high spirits. The womb in woman is a synonym for the uterus, which exists for menstruation and nourishing the embryo and fetus. The function of the uterus is to some extent dependent upon the fluence of the pure energy of the kidneys. Diagnosis. The 4 methods of diagnosis. The 4 methods of diagnosis refer to the diagnosis by observations, questioning the patient, hearing and smell, and taking the pulse. In clinical practice, the four methods are used in combination. Detecting internal conditions through external manifestations is the key to diagnosis in Chinese medicine. This is based upon the theory that any internal conditions will be manifest externally. Thus, a physician is able to know about the internal conditions of a patient through such external manifestations as complexion, skin conditions, and the spirits. Diagnosis by observations. In making a diagnosis through observations, the physician uses the power of his or her eyes to evaluate the patient's spirits, general physical condition as manifest in muscle, bones, and skin, eyes, outlets, complexion, and tongue. In the case of very young patients, fingerprint observation is also included. Observation of the spirits are intended to determine whether the spirits are there, lost, or prolapsed. A person's spirits are present or a person is in good spirits. When his or her eyes are active, speech is clear, complexion is moist and shiny, and breath is in balance. When a person is in good spirits, a disease can be more easily treated with better results. A person's spirits are lost when his or her eyes are passive, speech is incoherent, complexion is dull and dry, and breath is in imbalance. When a person is lacking spirits, a disease may prove more difficult to treat. Prolapse of the spirits refers to a deterioration of the loss of the spirits, which indicates a critical stage of a disease that should be treated as an emergency. By observing physical conditions such as muscles, bones, and skin, a physician is able to know about the conditions of a patient's energy and blood. Observations of the spirits as expressed through the eyes can prove useful in understanding the conditions of energy and blood in the internal regions. Observation of outlets is also important. Outlets refer to the outlets of the five viscera, namely the tongue as the outlet of the heart, the nose as the outlet of the lungs, the eyes as the outlets of the liver, the lips as the outlets of the spleen, and the ears as the outlets of the kidneys. Observations of these outlets will enable a physician to understand the conditions of the corresponding viscus. For instance, a crimson tongue will indicate burning of heart fire. Blisters on the tongue will indicate dampness, heat in the spleen, and ringing in the ears will indicate an exhaustion of the kidneys. However, in making diagnosis, the whole body should be taken into consideration, and for this reason, other aspects of diagnosis should also be taken into account. Observing a patient's complexion includes evaluating whether the color is deep or superficial, and dispersing or gathering, and whether the skin is moist or dry. Brightness is seen as a superficial color that indicates a superficial disease. Darkness is viewed as a deep color that indicates a deep disease. A light and falling is one that is dispersing, which generally indicates a new disorder involving the superficial region. A deep and accumulating color is one that is gathering, which usually indicates a chronic and severe disease. A moist appearance of the skin indicates the presence of stomach energy. A withered appearance indicates the decline of stomach energy.